This is a podcast from News Talk Radio 710 WOR.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. How are you? Hope you're fine. This is Gil Lederman, Dr. Lederman, and we're here on Radiosurgery Hour talking about new cases, talking about new news, and there's lots of new news this week. This was the week of the National Cancer Meeting, something called ASTRO, which is the world's largest radiation cancer meeting. It was held in San Francisco. When we were there, we had several presentations of our work, which was acknowledgement of what we believe is innovative work and pioneering work. And we, of course, were first in America and first in the Western Hemisphere with body radiosurgery. So we have fought to bring this technology to you and have a very extensive experience. And we know that experience pays handsome dividends to you, the patient, when you have to rely on your doctor, because it's a joint partnership. It's the doctor and the patient. The patient is the president of the United States of their body. Yes, that's right. Sometimes people forget that, but you are in charge of your body, and you have the right to choose your physician, and you have the right to make the decisions, and you can decide what's best for you. And we're here today, and we're here every day to try to give you the best information, to live the longest, to keep your body intact, to avoid unnecessary surgery or chemo for cancer. We're a cancer treatment center located in the heart of Manhattan at 38th and Broadway, 1384 Broadway. We take most insurances, Medicare, Medicaid, and we're there to help you. So whether you have a known cancer, a new cancer, or a cancer that's just not responding to treatment, or you have a lump in your neck, or a lump in the breast, or you have prostate symptoms that are not getting better, it might be useful for you to give us a call at 212-CHOICES, 212-CHOICES, which is 212-246-4237, 212-246-4237. I want to give some examples of our work and a lot of news, as I say. So we're going to jump right in. The first patient is a young woman, 44 years old, with cholangiocancer. So it's a cancer of her biliary tree. Now, she's a lovely woman, married, 8 children. She lives in the Virginia, Maryland area. And she's had extensive surgery and chemo, which is just not working for her. So at one point, she and her husband and her surgeons and her chemo wanted to cut out her lung because they couldn't control the cancer. I said, no, please don't do that. You may need your lung. And luckily, she listened. She canceled that surgery. She had radiosurgery, and we were able to use non-invasive radiosurgery to hit the cancer, and guess what? It totally went away. We have a caller already, so we missed that call. You can call us, by the way. We're live in the studio, WOR. Bob is there. Ed is there. They're both fantastic. And the studio phone number is 800-321-0710. 800-321-0710 is the studio number for this hour. And again, we're live, so you're welcome to call. And for the person who just called, you may want to call that number. If it's a medical question, call anytime, day or night. And if you want to get our booklet and DVD, just call us during the work week. Anyway, we were able to convince this woman not to lose her lung. We treated her cancer in her lung with radiosurgery, and guess what? It totally went away. So she is super happy. We just saw her this week. She has a new nodule. She was going to have ablation where they put instruments in the body, and she loved her pulmonary man who was going to do that, but they were unable to be successful. So she came back with a new nodule that she wants us to treat, and she's hoping that, like the last multiple nodules that have been obliterated by radiosurgery, that we can keep on our good success. And most likely we can. There's not resistance to radiosurgery like there is to chemo. Sometimes people take chemo, but after a while the body develops resistance and the cancer develops resistance, so the chemo doesn't work anymore. Also, chemo is not focused, so it goes throughout the body from head to toe. Surgery is invasive. So with us, our work is focused on the cancer. It's non-invasive. People come in, get a treatment, get up, and go to work or go home or go to lunch or go across the street to Macy's. What they want, which is to be active and be with their loved ones and sleep in their own bed every night, not in the hospital bed. So we wish this woman well. Congratulations for your trust in us, and I think we've proven time and again we've been able to obliterate your cancers without the chemo, without surgery, without hospital stays, and without complications. So I think that's what most people want. We had another patient who came in. Actually, we had a lot of patients this week. Another one in the good news department, a woman who came from Russia. She's a Russian immigrant with metastatic breast cancer. Excuse me, she's about 65, and she does not want chemo. She has metastatic cancer. She's had complications from surgery. She hates chemo. And she comes to us. So when she has a nodule, she gets scans, she gets nodule. If she has a nodule, she usually comes. She wants treatment. We zero in and hit the cancer for her metastatic breast cancer. A lot of people are told, oh, you have metastatic cancer. It's a systemic disease, therefore you need chemo. Well, that's one opinion. And obviously you can have chemo if you want. That's perfectly fine. But there's many people who just don't want to have chemo. They don't want chemo in their body. They don't know the side effects or the complications. This woman is one of those women, and she's done fantastically with metastatic breast cancer, stage 4, on focused beam treatment. She usually gets a scan about every 3 months. If the cancer's in remission, I tell her, fantastic. Congratulations. It's the good news department. If a nodule shows up, we talk about it. We talk about all the options. And I'm happy to talk about all the options because I think that when you hear about all the options and then you hear about radiosurgery, most people choose radiosurgery because it is such a nice treatment, focused on the cancer, non-invasive, without the side effects of systemic treatment or surgery. So for this woman with metastatic breast cancer, she sometimes gets treatment, sometimes doing great. Just send her home. I'll see you in 3 months. Call me anytime you need. You're welcome to call it day or night, 212 choices, and we'll take care of you. So she is in the good news department. We had another woman who came in, 64-year-old woman, single, who was being worked up for lupus, an immunologic disease, when she had a chest x-ray which precipitated a CAT scan, and the CAT scan showed a mass in the lung. on the right side, another nodule on the left side, and an adrenal mass. The adrenal glands are the glands that produce a lot of hormones in the abdomen. They're called adrenal because they're just next to the renal, which is another word for kidney. So they're on top of the kidney. So she has a lung mass on one side, on the other side, and an adrenal mass. She's just 69 pounds. So she came to us for a second opinion. We're going to get her staged up with better testing. We are going to, if she wishes, have a little needle put in, which is painless. Can numb up the skin, put in a needle, suck out some cells, and get her diagnosis so she knows exactly what's going on. She was curious why the other doctors didn't see the mass in the adrenal gland. Well, we tried to review the patient. We tried to sit down and spend time with the patient and review the records. We got another caller, so let's see if we can get... Whoops, we missed the call. Again, if you want to call us and speak on the air, it is the studio number, 1-800-321-0710. So for this woman with the mass in the right lung, the left lung, and the adrenal, certainly if it's cancer, it's something we can treat. We're going to get an answer to her, and we will talk about her probably next week on the show, what the test shows. Our success rate in treating lung cancers, where we aim the beam, is 90% for the life of the patient. So often when people talk about chemo, they will talk about what happens in 6 weeks or 12 weeks or something like that. Our data is for the rest of the life of the patient, where we aim the beam. And that just shows you the power of radiosurgery, that it is very successful, with overall about a 90% success rate, even in the adrenal gland. And we recently published a report on that. We have another man who came in this week with metastatic prostate cancer. So again, stage 4 cancer. He had metastatic prostate. One area of cancer was in the skull by the brain. He was having terrible headaches behind the ear, and he had a big mass. Again, with radiosurgery, it means that we can not only focus the beam, hit the cancer, but we usually do it in just a few treatments. So many people go for radiation and they get 20 treatments, 30 treatments, 40 treatments. No, this man just had a few treatments. He came in this week, and it's like many other people I've talked about just over the last few minutes. He had stage 4 cancer. He's in remission. The cancer's gone away. He's doing great. No side effects, feeling fine. We hit the cancer in the bone. We hit the cancer in the skull. His pain's gone away. The cancer's gone away. He's in remission. Had a follow-up this week. Doing great. Everything's okay. He's going to come back in January. And he's very, very, very happy with the results of focused beam treatment compared to other methods of treatment. This is Dr. Lederman from Radiosurgery New York. We're talking about cancer treatment. We're a cancer treatment center. We're a private cancer treatment center, which means we work for you. There's no secret hands. It's not the drug companies who are paying us or the surgeons who are paying us. No, we work for you. We take most insurances, Medicare, Medicaid. We want to give you all the choices, whether you want our treatment or other treatment. You'll hear about them. We're not shy to talk about all the options, and that's because we believe and we have data showing benefit for many diseases in many sites of the body with non-invasive focused beam treatment. But we'll show you the data if you want. You just call us and make an appointment, and we'll talk about it, or call us anytime for medical questions at 212 Choices. We're going to hear from our sponsor, some new voices, and then we'll be right back to talk about more cases and more news. And we have lots of news, even while standing up is better than sitting down.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super